Hi there, I'm here to talk to you about the COVID-19 rapid test. This test can use capillary whole blood or serum or plasma. We think that probably the most applications will be with whole blood, so I'm going to conduct a test and show you exactly how it works. The tests come in a box of 25 kits, and each of the 25 boxes come with a buffer solution and also the pipettes that we use to take the sample from the finger. In addition, you will need some lancets to get the sample and apply it to the cassette. Right, so the first thing we do with the cassette here is just make sure that the test is within its expiry date, and then it's just a case of opening this cassette up and getting it ready here. So on the cassette at the top we have a control line, and then we're looking for IgG and IgM antibody. We have the sample well and the buffer well at the bottom. So the next thing is to get the sample. So we need the equivalent of around 1 standing drop of blood sample into the cassette. So we just introduce the pipette and suck that up and add it to the sample well. So perhaps a little more is needed. So we want the equivalent of 1 standing drop. So once that is in place, then we need to add 2 drops of the buffer solution into the buffer well, which is the one at the bottom. That's 1. And that's 2. So now the buffer solution will be travelling through the test, picking up the sample, and then what we want to see is a pink wash coming up through the cassette. So we'll look at the results in a minute, but what we want to see is a control line, and then in the case of a negative result, absence of lines at these 2 points. Right, so we can inspect the result now. It's just been a couple of minutes since I introduced the buffer, and we can see right at the top of the test here we have the control line nice and visible here. And in this case, it's a negative result because we have no IgG line or IgM line. So those are the ones to look out for. We'd expect to see a line similar to the control line appearing if we have a positive result.